All right, well, it's 2 o'clock. I'll try to go ahead and get the meeting started. So my name is Felipe Keystion, and I'm with the LMSA Mentorship National Board. And we're doing these like talks about different rotations. That way you have an idea what you're doing once you get in. So this is a pediatrics rotation. And if any point you guys have any questions, put them in the chat. I'll be moderating that. Oh, sorry, did somebody say something? Okay, well, if at any point you have questions, put them in the chat.
Laptop's acting weird. Yeah.
Let's see. And like I said, I'm the moderator. My name is Felipe Keystion. Approve. Okay. And for our panelists, we have Diane Machino and Winnie Lourdes Diaz, both M4s. Diana, as you can see, is from Philly, College of Osteopathic Medicine, and Wendy's from Georgetown University School of Medicine. And the emails are here, and we can send these PowerPoints out after if you guys have any questions. Cool. So with that, I'll let our panelists take over.
Hi, everyone. I'm actually on my phone. My laptop isn't working, so sorry my camera is off. Just to introduce myself, my name is Diane. I'm an M4 at PCOM in Philly, and Wendy is the other speaker today, and she's also an M4 at Georgetown. So just to start off, we wanted to each talk about our experience in peds, but a general overview of the pediatrics rotation is there is a mixture of inpatient and outpatient with a clinic focus in various subspecialties within pediatrics. I personally worked with attendings during my peds rotation, and I mostly had an outpatient clinic experience with a few days in the NICU.
So I mostly worked inpatient actually, and with residents in my outpatient setting and inpatient setting with attendings like Diane, and then
Keep that, and then those papers. Can you, the little one? Oh.
Mari? Sorry, thank you. And then neonatology was the group subspecialty that I worked with.
And then there is a wide variety of age groups within pediatrics. So you'll have anywhere between a newborn infant to young adults, adolescents up to the age of 18. I even had a few that were like 20 or 21 that they want to switch over to a general practitioner yet. So there is a wide variety in terms of the age groups that you will be seeing. And just to be aware of is that you are seeing the pediatric patient, but you're also meeting their caregiver, whether that be their parents, grandparents, older sibling. Sometimes they're siblings that come in together, so you are meeting with their families. Like I mentioned before, I had more of like a clinic setting, so I was 8 to 5 or 9 to 6 p.m.
Yeah, and I had more inpatient, and my morning started pretty early, and I had to drive about an hour to get there. So for the most part, I would wake up probably at 5. The afternoons could be late depending on the cases, but most of the time they were early. I think it really depends on your school. I know University of Virginia was at the same hospital that we were at, and they had 12-hour shifts. So again, it's going to just vary depending on your school.
And then just to talk about our individual experiences. So like I mentioned before, I was in mostly a clinic setting. So I worked directly with 2 attendings, and there was also 2 nurse practitioners. And I was only with 1 other student. So we would actually switch off seeing patients that were coming in. So I was seeing a lot of patients during that time. And then I would go to the NICU twice a week. and that was anywhere between like 8 to 12 or like 9 to 1, like a half day. And that was just rounding with the neonatologist that was on call that day and seeing a few infants, also jumping into any like births that were happening to like receive the newborn infant with the neonatologist. So I found that like very interesting. What was challenging was definitely learning the newborn exam, not just like the physical exam, but also newborn questionnaire for like the parents. That just takes a lot of practice, and there's videos on YouTube that definitely goes over like how to do the newborn physical. I also had some trouble at first, like talking to the adolescents, just like at a level where they felt understood because they're not children and they're also not exactly adults yet. So you want to make sure you give them some autonomy with their care and kind of talk to them at a different level than you would talk to a smaller child. I did enjoy working with the various age groups. I thought there was a lot of variety within pediatrics, different patient presentations. How I prepared for my rotation was each evening, like as soon as I would go home after making dinner, and just I would review anything I saw in clinic that day and how to manage that medical condition. Like I mentioned before, I mostly worked with the attendings. And there's really no stereotypes in pediatrics. Like everyone is really kind. I'm on my audition right now, and all the residents have been so kind. Same with the attendings. Everyone is very easily to talk to. So I think overall in peds, everyone is really nice. Patient populations, there were patients that were pretty diverse, various socioeconomic statuses, different backgrounds. Where I am now, it's in the middle of Philly, which is a pretty big city. So we do have a diverse patient population.
So in terms of my experience, I loved pediatrics. It went wonderfully. I didn't know what to expect. I never really worked within like a pediatric setting. So the thing that I think was really challenging for me was that specifically for inpatient stays, there were a good number of patients, very young, who their parents couldn't be present. So 18 months and has like a respiratory illness. And so then there's a lot of assumptions that can be made, but really developing that relationship with the family while they're not there, and staying attuned to what the baby needs, because they can't tell us what's going on, right? So that was challenging for me, on a more emotional level, I would say. What did I like? I love the environment. I'm particularly very fond of like lots of cartoons and stuff like that. So it just was very fun. There were no dislikes that I had during this rotation. And I prepared for the rotation by talking to my peers that took the rotation previously. And I am a morning person, so I would wake up probably a couple hours earlier before I'd have to go into the hospital, and I would read over the patient cases that were going to be seen in the day. And I would do some reading on everything from the pathophysiology to the complications, to be able to prepare an assessment and plan as I saw the patient. So obviously you're assuming a lot of things, but you can think about all the like key branching points that you might want to cover. And what were the attendings and residents like? They were just wonderful as well. And the stereotype is that pediatricians are nice people, and I would say that I agree. Patient population, like Diane said, very diverse, in every possible way that you can think of.
And then study strategy, sorry.
I'll go ahead.
Sorry about that. Study strategies, definitely make a plan in the beginning of how you want to break down going over topics, doing questions. And if you use Anki for like M1 and M2 years, then definitely use it for like M3 rotations. But if you're not a big Anki person, then I wouldn't like try to start that now. Question banks, mostly like UWorld. I am in an osteopathic med school, so we have other question banks for like osteopathic specific topics that we need to review. And then Wendy, if you want to talk about the other half of the slide.
Yeah. So I really like Amboss in general when I'm doing New World questions. If I don't understand what is going on, it's probably that I don't know what the pathophysiology of something is. So I found that was really helpful for me. Amboss in general gives you a lot of detailed information. For me, online med-ed videos was great, but the best was Emma Holiday videos. If you Google Emma Holiday, you'll have access to all their 4 different PowerPoint presentations, one of them on pediatrics, and she just goes over everything that's high yield. So I would actually listen to that at least once a day for part of my rotation, the like second half. And there are Anki cards to that too. And she has a PowerPoint presentation available, but it's not all available on YouTube. You have to kind of just Google and find the different pieces that I mentioned. But I found that extremely helpful, especially since pediatrics, just like internal medicine, is so broad and we don't get a lot of education of it in our preclinical years. So that could be overwhelming. And Dr. High Yield on YouTube was something that Diane mentioned was really helpful. And then Anki, I actually started using Anki during my clinical years and not my pre-clin years. And I did it a lot while there were like brief moments of study time that I needed to learn things like at 6 months, these are the things that I'm going to talk to mom about or dad about. At 12 months, this is what I'm looking for. Those kind of things that are just like rote memory, I thought was specifically really helpful for peds. Practice tests, I'd say that the best ones are the ones for MBME. They cost $20 each, but it's an investment worthwhile. And podcast, we talk about divine intervention, I think is very helpful. Peds Cases is also another website that's very helpful.
And then succeeding in the clinic, definitely some key things in pediatrics is developmental milestones. If you're doing mostly like well-child visits, a lot of the younger children, there's definitely a lot of milestones to review. Vaccine schedules is another big one. If you just Google, I think the CDC website has a really nice formatted outline of the various vaccines and age groups. Definitely learn how to use the interpreter machine, whether that be an iPad on wheels or a number you have to call in on your phone. Some of these clinics have only one machine, so you may have to like wait and then or use your phone. And then have an outline for presenting your patient, whether that's a resource that's been given to you through your school. Like I know on our Blackboard site, we had some sort of outline for presenting patients. There may be like more specifics within pediatrics, but having a good outline to present your patient is definitely key. There's on Amazon, there's these like H&P notebooks. So I would definitely recommend that for not just PEDS rotation, but any rotation where you're presenting a patient to an attending.
And then in regards to getting good evaluations, I personally like to focus one subject of interest and then prepare a one-pager and present it to the team. I usually pick something that I'm weak in, like a topic that I'm weak in. It helps you just let your team know that you're interested, and you could do this across the board for every single rotation. And I would also say to be proactive and offer help to the residents on any tasks for the day. Express the fact that you're interested in learning as like different situations come up. The team will obviously let you know whether or not it's something that you're like prepared for to perform, or they'll let you tag along. And then I would say that on the first day of your clinical rotations, just sit down and chat with your residents and attendings if they're available to find out what it is that they would like you to accomplish and what expectations they have. So whether that's time, your lunch hour, little things, as well as like the bigger things, like we want you to see X number of patients, we'd like you to write X number of notes. And then what, like every single rotation, you're going to present differently and you're going to write notes differently. So making sure you ask, like, in the general appointment, what are the things that you want me to cover? So once you have all that information, then you could succeed every time.
And then for boards, high yield topics that definitely come up is the different categories of like classifying asthma, medication management, like the step up approach, that ladder of medications is definitely important. MSK, pediatric conditions, that definitely shows up on practice questions. Developmental, like normal versus pathological. I just took boards last week, so I think in terms of like practice questions that you go through your pediatrics rotation, just covering any weaknesses later on for step studying is very helpful. And overlapping rotations, family medicine rotation definitely overlaps with pediatrics, because in family medicine you are also seeing children as well as adults. I actually had family medicine before pediatrics, so it was a good intro in terms of like how to assess a child versus assessing an adult, how to like talk to children differently. So I would say it definitely overlaps with family medicine. Wendy, if you wanted to add anything.
So I'm currently studying per step 2, and in our practice questions, we get a lot of pediatric questions. So I would say every single subject is a high yield. By that, I mean, every rotation is. So the more you learn on your rotation, not just to like answer the questions correctly, but you know, kind of what's really going on in detail with how you should. I think the hardest part for me during rotation was knowing what to prescribe, whether it was an antibiotic, what type of antibiotic, that kind of information, and having no clue of where to look for that type of information as well. So online meded is a really good resource for that. Things like how to manage insulin and medication in a patient, those kind of questions, they come up mostly in clinic, but also in some way or another, I think so far as I'm studying for step 2. And then the best way to review rotations for step, you know, if you use your Anki, use Anki, reviewing videos, and then reviewing any topics like Diane said, that you had difficulty with.
Hey, we just had a question real quick pertaining to how you guys are talking about writing notes. Angie was asking, did your schools provide you any guidance on how to write patient notes for each specialty beforehand, or was that something you learned when you were on rotation?
For me, it was definitely on rotation. There is some sort of like just general, this is your SOAP note format, but every single rotation has a specific way that they like notes written, and even like down to your resident that you're working with. So a lot of the process for me was observing, asking, and then as well like mimicking So I thought that was really helpful because we already have access to like the residents note before, and we can see sort of the format. And then from there go forward to ask the questions. For me, what was more difficult than actually writing the notes was presenting. I felt like I could not speak English when I had to present at the very beginning, but even sometimes now when the case is complex and there's a million things going on with the patient, I had a lot of feedback, especially in internal medicine, on how to do that, and then learned that every single rotation will have a certain way that they want it. So I would say that that guidance, even though I was getting it from attendings and residents, the most helpful was actually my peers, fourth year medical students in my school. I don't know if Diane has this.
Yeah, I definitely agree. I think each rotation, the note is very specific to what they expect. So what I would do is if I had a resident on my team, you can ask them if you could like practice writing a note. And if there's time at the end of the day, hey, like, can you please look over my note, give me any feedback? Or if you have an M4 student, you could also ask them for guidance about writing notes. Now that you're on clinicals, I'm pretty sure you should have access to the EMR system, whether it's Epic or PowerChart, whichever system you're using, you do have access to see previous patient notes. So that's also a good way to see how the residents are already writing notes and their general outline. I agree also, like, I think I had difficulty at first, and it is a work in progress on like how to present patients, because if you're on internal medicine, they're expecting all of the information from the patient, all like a bunch of problem lists, right? But if you're on surgery, that presentation is actually a lot shorter, and even the note is a bit shorter. So it is very rotation specific, but I think if you just ask a resident who's willing to give you some advice on note writing, that would be helpful, or even an M4 student who's on the rotation with you.
Great. Thank you, guys.
And then just some final thoughts about pediatrics is have fun. I think it was one of my favorite rotations. I came in kind of unsure about pediatrics or family medicine, but after peds, I was like, this is for me. Like, everyone is so kind, willing to teach you. Definitely get to know the medical team, the expectations from the attendings or the residents. When you're examining pediatric patients, explain to them exactly what you're doing at a level they understand. Something, for example, if you're listening to heart sounds, like show them your stethoscope, what it's used for, listening to your heart, maybe even let them listen to their own heart. I think that's something that really makes them feel included. Always introduce yourself to the patient, not just the parent. Ask them about their favorite book or their show. Now that it's the summertime, what are you doing over the summer? Are you going to the pool? Are you going to the park, or anything like that? It really helps to build that connection with the pediatric patient.
So some of the other thoughts that we wanted to share is, if you do end up deciding to go on a pediatric career, there are a lot of URIM scholarships for your fourth year. Both Diane and I are actually going to be attending some, so we're really excited for them. They give you the money to travel, they give you housing. Every program's a little different, gives you mentorship. And these usually, the URIM scholarships exist throughout all of the different fields. So if you are interested in something else that's not peds, this isn't the website, but if you just Google it, you'll be able to find a lot of different opportunities. And then I mentioned that you could consider studying or reading the ACEs study if you haven't read it yet. I think that as minorities, it's particularly important to understand the different traumas that our patients can come into. And because this study is specific to pediatric patients, it's just helpful to know to provide trauma-informed care to our patients.
All right, and with that, thank you to our panelists for such great advice. We really appreciate it. And now we'll just kind of open the floor. If any of you guys have any questions, don't be afraid to turn your mic on, or you can just put it in the chat.
Hi, I have a question. I heard that you have to waive the right to read a LOR before submitting it. What is the rationale for that?
So I believe waiving it, so you're technically not supposed to see what your letter of rec writer says about you. I think for application, like for residency applications, that's just one of, like, they won't really look at your letter if you did not waive the right. I don't know the exact answer to that, but what I've been told is you should always waive the right to view your letter.
I was told that the reason why they do it is to keep the writer themselves as honest as possible without the potentiality of hurting our feelings or being influenced by something that we might want them to write. The idea is just to be more clear, as the writer can have more autonomy, I would say.
Oh, got it. Thank you.
Sure. Any other questions?
Okay. Do you guys have any advice you just want to leave everybody with in regards to like rotations in general or pediatrics specifically?
Yeah, I think starting with like transitioning from preclinical to clinical years at first, you get really nervous. You're like in the hospital now with residents attendings. But you've made it this far. Be confident. This is a new environment, so you're learning every day. It's okay to not know something. I've said multiple times on rotations, if I was asked a question, I don't know the response, but I can look that up, and sometimes they'll let you talk about it again tomorrow. So it's okay to not know everything. You'll be learning new things. And with peds, I just fell in love with peds. And if you guys have any questions about pediatrics, or if you're interested in pediatrics, please email. Happy to answer any questions.
And then I would say, I always like to carry a good number of pens. Everyone always needs a pen at some point to sign, and we usually use our computers. So that they say that that's like the med school student's role. So it's always helpful. Know where your napkins, Kleenexes are in the room in all rotations. I always like to carry also like a little notebook. I write down the things that I don't understand, but I'm too nervous to ask. And I want to do a little bit more reading before. Sometimes when you ask questions, depending on the attending or the resident, the questions get reverted back to you. You'll learn that. And so you have to be able to answer some at some point, at some level. And if I felt really uncomfortable with a subject because I didn't, had never read too much about it, I would just do a little bit of reading. And then the next day I would bring up my question and then I could get clarification. So just doing a little bit of your homework and remembering to do that was why I really liked my little book. Or when I was being taught something, I would always write it down as well. Dot phrases. I'm not sure if you've heard of dot phrases, but from what I understand, all systems have it. It's basically a dot, and then it outlines what you need to fill in. And your residents will usually have dot phrases, so you can just gather the dot phrases that they have, and that'll make your writing of your note much faster. It'll make sure that you remember what to do while you're also in the room with the patient.
Thank you for that. Does anybody else have any questions?
Oh, and also please feel free to reach out to me if you're interested in pediatrics. Very interested in it, obviously, and would be happy to chat.
All right, I don't see any questions. Well, thank you guys for coming, and thank you to our panelists for taking their time to talk to y'all. And if y'all need anything, we'll send an email with their emails list in case you want to contact them more.
Thanks,
Cool.
Jason. Thanks, everyone. Have a good one.
Thank you so much. Have a good one.
Have a good day.